right, today is the big day. Today is September 6, 2016. Yep, hospital parking, make a left. And so I'm here to get the interstim done. I already had the trial. That was semi-successful. I went like 4 hours without having to use the bathroom. So I'm hoping for great results with prayer for the permanent. Okay, again, today is the 6th of September, 2016. I've been taken back, so right now I've had this right here inserted. So I'm not under the influence, in other words. Where are you at? There you are. So now I'm just waiting for my doctor to come back. I've had the assessment done with the nurse for the SNS. I'm so excited. I just pray that it works. Okay, I'm out.
What's up, all, and welcome back. So for this edition, we're going to discuss how I felt about the permanent placement of the interstim, the SNS by Medtronic. Now, in the opening, yes, that does take place from 2016. Here we are all the way to 2022, and how far have we come when it comes to interstitial cystitis or pelvic bladder pain? My journey with the interstim actually didn't stop really until 2021 as far as the discussion. But to back up, you guys, when it came to the trial, I would never recommend this. Why the doctor recommended this, I have no idea. I only did the trial. I feel like it was not a significant amount of time. It was only 2 days. Yes, 48 hours for me to give feedback to say how well I did. Well, as stated in that opening, I did good for about 4 hours, and I figured, okay, I might as well move on. The doctor approved for me to move on, but in actuality, 2 days was not enough, because now when I do research and I listen to about other patients who have done the trial for the SNS placement, it was not no 2 days. It's like anywhere from a week to 2 weeks, and sometimes people even do it longer, but in no way was 2 weeks enough time. But in doing so, when I was getting ready to do the trial, I was given a sedative to relax me. I was not given any pain medication. This was done in office. So lead placements were done to see how I would respond, to know if they were in the right area, by vaginal, like if you could feel it there and where. Also by how my toes were responding, to know if they were in the right placement for the trial. So once that was established, I was on my way. I had to have a driver because, again, they did give me a sedative during that phase. But even when I went to the doctor for the consultation to discuss possibly doing placement, it took me about 2 years to get my nerves up to even go through with the trial. I felt like I did a good job on doing research on who was possibly going to do the placement. But in actuality, as we all know, not everyone is very versed or well versed when it comes to interstitial cystitis, whether you're male or female as the patient. They're just not. A lot of doctors are just not. And the doctor that I went to, I had my medical records in hand. That's why I'm always an advocate to have your medical records of everything that I have tried. I've tried the IC diet. I've tried every possible medication at that time that was out during that time, and I did not have a success rate. I even did pelvic floor therapy at one time. Yes, I did do Botox. I'm sure it may be some other things that I might be missing as well. But that doctor was like, "So you're just ready to get it on." He was very hyped. I don't know if that was a good thing or a bad thing, but at least he was, up for the energy to do it, because I had one doctor that I just casually mentioned, "What do you think about the interstim, the SNS?" That was the same doctor actually who had did my bladder Botox, because I went twice to 2 different doctors. And he told me he felt like it's just a high price procedure that's about $60,000. And a lot of times patients do not get anywhere with it as far as to remedy their urinary symptoms. So a common question that comes up is the interstim for pain? Is it to reduce your urinary frequency? In my case, it was prescribed to reduce my urinary frequency. The way pain is described with this diagnosis of interstitial cystitis, to that extent, I cannot relate. I can relate about the abdominal pain, of pressure, not pain, but of pressure. But once I go ahead and void, then I feel better and I don't have that pressure. But there have been patients that I have read about that said that their pain level has been reduced. But me personally, I cannot speak on that, just about the frequency aspect. So once I went on, got the placement done, I had some relief that lasted maybe about 48 hours, but it wasn't like a continuous relief. Now in the remote, the Medtronic remote, there is a set of 4 programs that they set you up. This was the remote at the time that I was given, and then you have batteries that will be placed back here to operate it, and then this here would attach to the remote, and then this pad here where the incision for the Medtronic pacemaker battery was placed in the incision. This is how you would control it. And you could feel it pulsating when the remote would be on, and then you would find different channels to try out. And there were up to 4 in this remote. And then I was able to increase or decrease the frequency of the pulses. And then if it was too much that I was feeling in your bicycle area, then I would decrease it. But that was one way of knowing, and also what you were feeling in your foot. So it was actually placed on the left side. I thought the doctor did a really good job of the incision, and that the reason why I'm saying that is because I had, steri strips, and so they were to fall off in due time. So he did the steri strip to close up the pocket. I went on my way home. I did fine. My follow-up was in 2 weeks. I was given medication to control the pain. If I did experience some, it was recommended for me to have at least 2 weeks off of work if needed. But I actually wound up going back to work within a week. I was advised to take it easy, no heavy lifting, no bending, just really, really baby where that incision is. Avoid any possible situations that may require any climbing that could produce a fall. Just be very careful, because those leads, very new, they haven't yet settled in, so I had to be very careful how I did move with that, because I'm like, if this is going to work, by all means, I don't want to contribute to something going wrong and then I have to go back and then have something else done. So my follow-up was within 2 weeks. I go to the doctor and he asked me how I'm doing. I told him I'm doing fine. He took a look at the incision. The incision looked fine. And I did tell him, though, I felt like I was not getting the relief like I had experienced during the trial. Wow, the trial, that was 2 days. So he said, okay, the Medtronic rep is here. So therefore we'll have him to set a few more programs into your remote, and hopefully you will benefit then. So yeah, the Medtronic rep put some more programs in my remote. He was a really, really cool Medtronic rep, because all Medtronic reps are not the same, but that particular one I had, he knew his stuff and then some. So we did develop a really cool relationship with him, just teaching me about Medtronic Medtronic's, well, their devices, what else type of devices that they have to address other issues that someone might have, how to go about picking even the right doctor when it comes to even placements. All of this was mentioned. And he also told me who were the go-to reps in case he's not available. How and why he wound up telling me this, I have no idea. So, okay, he put some more channels into my remote. I go home. This time my follow-up was within a month, or if I needed to come back sooner, then by all means. So I went back within a month because I felt like, again, I still wasn't getting the relief. So this time, the nurse practitioner tried to upload some different programs. That didn't work out too well, and she told me that this was new for her to deal with the main device to put programs into my remote. So she said it probably will be best for me to come back when I can meet with the Medtronic rep. Well, okay, I go back on another time, another visit, and this Medtronic rep, he was absolutely awful. It's like he didn't want to be there. He could have really cared less about uploading channels into my remote. I don't know, he just treated the whole situation of customer service very poorly. So I said, well, no reason for me to say much, go back and forth, or to ask any questions. I just asked, when will that particular other rep that I did very well with, when will he be available? Because that's the only way I would show up. You know, I asked the office manager about that. And then I even started to call the office like the day before, the day of my appointment, to make sure that Medtronic rep was going to be there. Okay, so because I was not improving, I then decided to stay with the same practice, but I did wind up going to another urologist within the same practice who actually had wonderful bedside manners, so caring, so empathetic. And I'm like, okay, great. Let's see what he has to say as a second opinion. So he offered, the treatment option that he gave me was to change around the leads, do some retesting, change around the leads in hopes of me benefiting. So that fell under a revision. So he did a revision, and yeah, basically the same results. I really wasn't getting anywhere with the frequency slowing up with my bladder, this overactive bladder condition that I'm experiencing. So again, I met with a Medtronic rep, and he just said, okay, I'm just gonna tell you straight up. He said, if Botox is offered, if more medication is offered, even though you didn't do well, because I told him I never did well with the medication to slow down the frequency. He said, if it is offered, do know this, that the doctor is basically trying to mask your symptoms of your diagnosis, when in fact that's what the Medtronic device of the interstim was created for, so you wouldn't have to be on those medications. So then I'm like, oh my gosh, because medication was mentioned and possibly repeating Botox, although that office wasn't the one that did it, it was another office. And I'm just like, what am I gonna do? So then I take it upon myself to have a consultation outside of that practice with a whole nother urologist. What did I do that for? This is when things just took a turn for, I'm not thinking clearly. I've been on this hamster wheel for a long time, and I think by that time I was just really tired, because looking back, he was absolutely the wrong doctor for me. Talk about doing your research. I was told because he is the director of the clinic that he's the go-to. He's top notch when it comes to this condition. No, that's not true. Yeah, maybe the study of the bladder, but not of not of interstitial cystitis. This doctor began to tell me this was a sign that it was all in my head. How many times have we heard that or read about someone saying that in this community or even outside of this community that may have a diagnosis that something is all in their head? So I'm listening like, oh, but I have my medical records. This is the diagnosis. This is what was observed during my cystoscopy, hydrodistension. How in the world can this be in my head? So I'm listening like, well, dang, it's been in my head for a long time. Like, what's really going on? Then he told me to hop on one knee. Hop on one leg. So I'm doing this. Hop on the other one. So I'm doing all of this. So then he tells me that the reason why I didn't respond well to the placement of that Medtronic device is because it was put on the wrong side versus to how I'm responding with hopping on one leg versus the other leg. I'm like, oh, like I'm honestly, I was like all impressed, with everything that he was saying. But like I said, looking back, So he decided to switch it from the left side to the right side, but still using that same pocket. So the leads were switched around. Well, judging from my medical records, I was given I remember the doctor in the procedure room saying, stop giving her medicine, the IV, whether it was the propofol, the fentanyl, whatever this particular anesthesiologist was giving me. I remember the doctor just saying, stop, that is enough. Well, I guess so, because by the time I came out of recovery, I think I had a mini seizure. It was like uncontrollable shaking. And I remember I was given something to calm things down because of the way I was responding. So I was eventually released. And then I noticed as to how that incision was healing. It had blistered up. I remember that site felt so hard, but it was that scar tissue building up from that incision being opened, closed. And again, I still wasn't getting any better. Now, this doctor, I had to go back to my follow-ups, and I had to have the staples removed. If I could do that all over again, I would have asked, will you be using steri strips or will you be using staples? Staples, to me, in my opinion, is a thing of the past. He was a doctor of a certain era. I don't even think he practices anymore. But the way my incision looked, it just didn't look good, because where the original incision was, he extended the incision and then it kind of curved down. Why that happened, I don't know. Why it was blistering up, I don't know. But at that point, I just felt like what could have gone wrong, it did go wrong. Maybe the interstim is not for me. I know people have benefited from it, and I think that is awesome. Anytime it's a win for anybody in this community to benefit from something dealing with this condition, that is wonderful, and I applaud that. That's great. So what I wound up doing is going back to the original clinic, dealing with the second doctor, because I dealt with 3 doctors all together. I dealt with the second doctor, the compassionate one, and I told him that I just didn't feel good about the decision I had made to let this other doctor switch around the device. So he asked me, who is your doctor? And I said, you are. So he said, okay, since you will be coming back to me, let's go ahead and just do what it is that you want to do. Do you feel like it's not working? I said, I do. He said, do you want it removed? I said, I would love for it to be removed. So this is a stretch from 2016 to 2017 to 2018 when the device was removed. And all that was going on, I was trying different channels. I was really trying and wanting it to work. I was really hopeful about it. So I did have the implant removed. In doing so, we moved forward with another possible treatment plan. And I remember seeing that particular Medtronic rep, the one that was so helpful, and he was very supportive with my decision. And I feel like I did the right thing. Now, to bring me to 2021, the urologist that I started seeing, because again, guys, a lot of people don't know a lot about this condition, and you just really have to just stay in the race to keep trying to find, hopefully, the right doctor for you that can get you on a treatment plan to help what your symptoms are, to help manage them. So this particular doctor tells me, now I hadn't even brought up the device because that's not what I was there for. But doctors do like to get a history of what you have tried and what hasn't worked. He told me in my case of it not working, that had he been my doctor, that he would have offered me to have 2 Medtronic devices, because sometimes 2 works better than 1. And I've read some patients have been helped by that, but that's not something that was offered to me, and I'm actually glad that it wasn't. I was just done with the process of just being cut on, closed up, not knowing if it's the right doctor. But come to find out, that particular place that I did go to, according to the Medtronic rep, they do tons of S&S's all the time. The clinic is very well known to do those implants, but no, they don't work out for everybody. And some people that they do, everybody's story is different. He told me that the clinic that I did go to have it put on the other side, they're not known to do S&S implants. They're just not known for that. So he said, if ever in a case, just know that definitely go to a clinic that is known, that does however many a day, a year, a week, however that, works out. Because just because you got the MD behind your name and you're a urologist or a urogynecologist does not mean that they have the experience with that. So I believe I covered what I wanted to with this video. Yeah, so if you're thinking about getting the S&S put in, just do your research. That's all I can say. Make sure they are an approved doctor, even on the Medtronic site, and just ask as many questions as possible and go with your gut feeling too. That helps. All right, till next time. Peace.